It's really important to attend a lung health check because the targeted lung health checks across the country have managed to diagnose lung cancer and other respiratory conditions at an early stage. And what we know is that if we can diagnose at an early stage, it means the treatment's much more likely to be successful. Eligible patients initially have a telephone assessment, so that's with one of our nurses, and it lasts about 20 minutes. And so they'll ask some simple questions just about lifestyle, family history, medical history. If there is any risk identified, you'll go on to have a lung scan, a CT scan, very straightforward, performed in community settings, really convenient to get to either at a supermarket or a car park like this one.
You'll be given the address to attend, and once you arrive at the unit, there will be signs outside the door telling you which direction to go in. You need to attend the reception area, which is clearly signposted. It's got a steep set of stairs. Don't worry about that, we've also got a lift as well. So if your mobility is a little bit poor, you can come up in the lift as well. So attend the main reception, you'll be greeted by a healthcare assistant who will take your name, and you will then be seen by the nurse, where you'll be asked to do a blowing test, something called a spirometry test. And that will show us how your breathing is, how your lungs are performing, how much air you can hold in your lungs, how much you can breathe out. But the nurses are very experienced with doing these tests, so don't worry about the test at all, you'll be talked through it. After that, somebody will come and collect you for your scan.
I'll be honest, when I got the letter, I wasn't sure. I thought about it. But I've got a 2-year-old French bulldog, and I want to be around to see him through his days. If there's anything there, it can get sorted out, and I've not got the worries. If you just leave it, you never know, and then it's too late.
So the actual scan that you're going to have is a CT scan. It's not an MRI scan, which you also might have heard of. It's very open, there's no real noises.
I was petrified, I've had nightmares about it, but the minute I got on it, I realised you're not laying dead flat, you can have pillows under your head and a foam cushion under my knees. It was no problem whatsoever. You know, I'd go through it again.
The whole scan will take 5 minutes. You'll be given instructions over the microphone, when to breathe in, when to breathe out. It's a very simple test, very quick test. Once that's finished, you'll be able to get up, and that's it, your targeted lung health check is finished. Your whole journey and your whole appointment should take no longer than 30 minutes.
What I'd say is that if you received a letter but not yet responded, please call and book an appointment as soon as you can.
Think of what's important to you. If you had this done, if there is anything wrong, they can pick up on it and sort it. You know, so you'll still be around for the person that you want.